What's up, everyone? Welcome back to the Daily Sean. If you've never been here before, my name is Sean. I do a daily video, something related to nursing. No rhyme or reason, probably won't change. Today's topic, had a fan requesting some tips on test taking strategies, specifically for the SATA formed questions. Select all that apply. Huh? Why can't we just have a simple ask me a question and answer it? It can't be just a simple yes or no. No. We have to complicate things and make sure that there's multiple choice questions with multiple answers. Whatever. These questions are created to make you focus. Not intended to trick you, not intended to confuse you. They're intended to see how focused you can or cannot be. First things first, the best way to prepare for the NCLEX for this type of exam is to create the scenario. Create the environment for which you are about to subject yourself to. Do not read questions and then get the answer immediately. Look at the rationale. Oh, well, man, I knew that. It's not how you're going to learn. You prepare yourself for the environment. It's one thing to test yourself on the material. It's another thing to actually put yourself in that stress bucket. Put yourself in the box. It's just you and the computer screen. Silence. You have the headphones on. You and the click of the screen. You get a question, you click an answer, whoosh, you go to the next question. Question, click an answer, whoosh, next question. You have no idea if you've answered them right or wrong. We already had the discussion about the NCLEX and the 75 questions and the 95 questions and 265 questions. You go look that one. We should be able to throat punch them all. You need to prepare yourself for that stress bucket. Put yourself in that box. Dedicate an hour of your time as often as you can answering at least 75, preferably I would say 100 to 150. 150 questions non-stop, no break. When you take the NCLEX, you can take a break. That counts towards your total time. What, 3-4 hours now these days? That contributes to your total time. Sit in front of that computer screen. Focus. Your mind needs to be sharp from question 1 all the way to question 100. You can't have your brain shut off at question 50. Doing what I call mental aerobics. SATA questions. Select all that apply. Really just a series of true and false answers. You need to decide whether or not each individual answer is true or false. A through E, A through D. How many are there? Check mark it or exit off. Either I pick A, B, C, A, D, E, A, C, E, la. Select all that apply questions as a conglomerate of true and false answers. You'll be fine. First things first, maintain your calm. 7 steps. 7 steps that I want you to take with each of these questions. First step, read the question twice every single time. Read the question at least twice. You need to pick apart the question. You need to understand what it's asking you. Don't get distracted by the distractors. Pay attention to the stem of the question. Read the question twice every time, no exceptions. Read the question twice. Did I say that enough times? Read the question twice. And you understand it to mean the same thing both times. Number 2, is it a positive or a negative question? Are they asking for a positive answer or a negative answer? Understand the difference. Pay attention to the question. What is it asking for? What would you want to happen or what would you not want to happen? Positive, negative. Positive, negative. Okay. 3, do not look at the answers. What? You heard me. You don't look at the answers when you're reading the question. You read the question first. You do not look at the answer. Then it's going to sway you in how you read the question. So if you have to, you put your hand over the screen. I don't care what you got to do. Focus on the question. Do not look at the answers until after you have read the question twice. 4, look at the absolutes. Now it's time to move on to the answers. You look at the absolutes of the actual question. Now you get to view the answers, each one individually, one at a time. Treat each option as a singular answer. You're looking for the absolutes of the question, absolute of your singular answer, one at a time. Absolutes meaning everything, all descriptors that are absolutes. Always, never. If you don't have an absolute in the question, you better not have an absolute in the answer. Self-explanatory. 5, always focus on the patient. The answer is always to focus on the patient. Not you, not the doctor, not the family, the patient. You always should focus on the patient. Unless in the question, it refers to someone specifically. If it doesn't explicitly say it in the question, the answer is always the patient. 6. Create a scenario where your answer makes sense. You're going to do this for each individual answer. For A, then you're going to do it for B, then you're going to do it for C, so on, so on, so on. Create a scenario in your mind that answers your question with the answer that you agree with. Create a scenario. It doesn't have to be horribly specific. Create a scenario in your brain, whether from experience or not, that allows your answer to be true. If you can't create a scenario where your answer is true, then it must be false. Finally, eliminate an answer that is psychosocially incorrect, ignores patient's feeling, doesn't validate a patient's feeling. If you're not listening to the patient, you're not empathetic with the patient, if it's not psychosocially acceptable, then it is more than likely not a correct answer. 7 steps. Keep in mind with these select all that apply questions, you're going to have 2 answers. That's the whole point of having select all that apply. You're going to have at least 2 answers. They have changed the NCLEX. I had to look this up. They have changed the NCLEX format recently. All of your answers can be correct. They have the potential of all being correct. Let's just make things even harder. What do you think of my tips? Good? Bad? Great? Did they suck? I want to hear. I want to know. Tell me what you think. If you like it, please give me a thumbs up. Share this with somebody. And as always, check your own pulse first.